Come in.
Hello. I'm going to
Hey.
provide privacy, hand hygiene. My name is Brooklyn. I'm going to be your student nurse today. I'm going to check the provider's orders really quick. Okay, it's showing that I'm going to have to do a head-to-toe assessment on you. Is that okay?
Yeah.
Okay, can I verify your name and date of birth?
TC, date of birth.
Okay, that matches, and like I said, we're going to do a head-to-toe assessment, okay? So first I'm going to start off with orientation. So do you know where you are?
Yeah.
Okay, where are you at? You have to say it.
My house.
Okay. Do you know what month it is?
Yeah.
Do you know who the president is?
Yeah.
You have to say it.
Oh, what month is it?
What month
February.
is it? Okay. And who's the president?
President Trump.
Okay. Have you had any head injuries or accidents that caused damage to the brain recently?
No.
Okay. Can you smile? Okay. Now I'm going to assess your eyes. So if you'll look straight behind me,
Mm-hmm.
I'm going to assess your pupils. Okay. Okay. Now I'm going to assess your ears. Do you wear glasses?
Safety glasses.
Okay. Corrective lenses. Let me refrain.
No.
Okay. Have you had any ear infections in the past month?
I have not.
Okay. And if you'll, so I can do your nose. Okay. Do you have any nosebleeds or any drainage?
Yeah.
Okay. Is it like drainage, like mucus?
Mm-hmm.
What color is it?
White.
It's white. Okay. Will you open your mouth, please?
Yeah.
Okay. Everything looks good there. Do you smoke or do any tobacco products?
I do.
What tobacco product do you do?
Dip.
Okay, I'm gonna have to document that for our provider. Okay.
Okay.
So now, okay, I've done that. So now I'm gonna assess your respiratory. So I'm gonna listen to your lung sounds and all of your quadrants,
Alright.
and then I'm gonna do the cardiac.
Mm-hmm.
Okay, I'm gonna clean my stethoscope. I'm gonna assess the right upper lobe first. Take a deep breath. Okay, and left upper. Good. And then I'm gonna do the left lower. Okay, and right lower. Okay, and if you'll put your arm on this side, I'm gonna assess the middle of this is the left lung. Deep breath. Okay, now I'm gonna assess the right middle lobe of the lung. Okay. All right, and I'm gonna do the back. So now I'm doing the left upper. Go ahead. Right upper. Right lower. And left lower. Okay, so all of that sounds good. So now I'm going to assess your, oh wait, I gotta ask a subjective question. Have you had any respiratory infections in the past 30 days?
No.
Okay. Now I'm going to assess your cardiac. So I'm going to listen to your valves.
Alright.
So I'm going to listen to the aortic valve first, which is in the second intercostal space right here. So just sit normally. Now I'm going to listen to the pulmonic valve. Okay. Herb's point. Tricuspid. And the mitral valve. And also I'm going to assess the apical pulse right here for a full minute. Okay, I got 78. And then I also need to test your hearing. So I'm going to do a whisper test. And I'm going to whisper something and you're going to tell me what I say behind, at least 3 feet behind you.
Okay. A, B, C, D, E, F.
Okay, now I'm going to go to the other side. I'm going to do the same thing.
1, 2, 3, 4.
Okay, all that's good. So I've assessed cardiac. Now I have to check for edema and I need to check for capillary refill. So capillary refill is less than 3 seconds. Do you have any swelling that you know of?
Mm-mm.
Have you had any, do you have a history of heart issues, heart disease in your family?
No.
Okay, I'm going to check your, yeah, that's good too. Alright, so now I'm going to check your pulses bilaterally to check and make sure that they're good. For video purposes, he's got his boots on, and it takes a minute for him to take them off, so we're not going to do that. But I'm just going to tell you where I do them at. So if you'll do both of them, and just relax them. Okay? So they're both beating at the same time. 2 plus regular. And it was a 78 heart rate. And then on the top of the foot, I would go on the big toe, in the middle of the big toe and the second toe, and I would travel up and I would find his dorsalis pedis pulse and his popliteal pulse is behind the knee, and his brachial pulse is here. But all of them are good, and he has no swelling. Now we're going to do. So I did that. Now I have to assess the GI. So for presentation purposes, he does not want his shirt up, so we're going to do it with the shirt down. So I'm going to assess the right lower quadrant first. Yeah, just do your best. Okay, I'm going to do right upper. Here's some, that's good. Left upper. And left lower. Okay, have you had any diarrhea in the past 30 days, week?
Mm-mm.
Okay. Now lastly, I'm gonna palpate it too. So I'm just checking for any masses, anything that's abnormal. Okay, now that seems good. Now we're going to do range of motion. So we're going to go over a few joints and I'm going to see how well you do them. So we're going to do the forearm joint. And what you do is, do your hand motion like that. So that's supination and this is pronation. So do both of them on both sides. Can you do both sides? Okay. Now we're going to do the wrist. So this is extension. This is flexion. Okay, do it. Okay. And then, like I said, this is extension, and then this is hyperextension. Okay? So now we are going to do the knee. So if you will stand, please. So the knee, that is extension, this is flexion. And you can do both? Okay. Oh, we're going to do the hip. So do like this. Okay. So the hip is... abduction is like this. Yeah. Okay? And then adduction is inside. So we're already in extension now. This is flexion. Okay? Can you do it on the both? Good job. And then hyperextension is in the back. On both. Good job. And then can you rotate them in circumduction? Good job. Wonderful. And I think that's all of those. Okay, and I also have to assess your gait and balance. So if you will walk like forwards and backwards. Well, anyway. And I have to ask a subjective question. Have you had any recent falls?
Mm-mm.
Okay, so now I'm going to do a little education on you. The doctor has ordered for us to do education for the respiratory, so I have to educate you on turn, cough, and deep breathe. So at nighttime, whenever you're having trouble breathing, you're gonna, you can sit. You're gonna turn, cough, and then breathe deeply, and that's gonna help you expel mucus. Okay, and then this is an incentive spirometer. I'm gonna have you hold it, and what you do is you inhale for 2 to 5 seconds, the most that you can, and hold it. You hold it for 2 to 5 seconds, and then you let it out. Okay, good job. And the cough and deep breathe. And then I have to educate you on safety hazards. So untied shoes are safety hazards. Grab bars that are not in the bathroom are safety hazards. So if you have trouble getting up or falling, you need to make sure you have grab bars. You want to make sure your rugs and your cords are not in the way. So you want to take the rugs out, and the cords need to be on the sides of the hall, okay? Because you don't want to trip over them. And then, let's see, the Glasgow Coma Scale, that's for people who have brain injuries. So there's 3 things that we look at. We look at motor, eye, and I forget the last one. There's 3 of them. So the eye movement, your eye movements were fine. You're oriented. You're oriented, you know where you are, you know what year it is, and such things like that. And your motor response, and we just checked all that with range of motion. So is there anything else that you would like for me to document for you?
No.
Okay, well, I will get that documentation, and the provider will be in shortly. Thank you. You have a great day.
You too.